2 years ago, I built an immersive VR prototype for a mental health therapist client of mine designed to support clinician-guided EMDR therapy and meditation experiences. The goal was to create a calm, focused space where patients could participate in therapeutic exercises paired with a custom, built-in EMDR feature on the Quest 3. Patients choose from a growing library of immersive environments, including forests, beaches, mountains, and other peaceful natural settings. Each environment can be paired with different therapeutic options, allowing the experience to be adapted to the patient and the goals of the individual session. For EMDR sessions, the application provides bilateral stimulation through alternating controller haptics. It also supports guided meditation, therapeutic audio, and customizable wellness activities. The prototype uses an intentionally large interface with gaze-based controls. This was designed with accessibility and ease of use in mind, making the technology approachable for patients and therapists alike. The next version will feature a vastly improved interface that is more intuitive for both patients and clinical professionals, while preserving the accessibility and simplicity that guided the original design. Although I didn't personally participate in or observe the therapy sessions, the feedback from my client shared from his patients was overwhelmingly positive. These experiences demonstrate the potential of immersive technology to provide private, repeatable, and highly customizable method of clinician-graded guided care. The next phase will include expanding the library of environments and therapeutic options, improving the overall patient experience, and developing a browser-based clinical control system. This system will allow clinicians and healthcare workers to remotely control the headset and guide the patient's experience from almost any browser-based device, including a tablet, computer, or smartphone. This system will allow clinicians and healthcare workers to remotely control the headset and guide the patient's experience from almost any browser-based device, including a tablet, computer, or smartphone. This could allow the clinician to select environments, start the therapeutic experience, adjust session options, and respond to the patient without needing to physically operate the headset. I'm currently looking to connect with therapists, doctors, clinicians, investors, and healthcare organizations interested in helping move this platform forward to the next stage. To discuss the project, its potential applications, or opportunities to collaborate, please contact me.